Hi, good evening, everybody. Thank you for joining us for another webinar in our series. Tonight, our subject is Play It Safe, Post-Pandemic, Sports Conditioning and Injury Prevention for Kids and Teens under the age of 21. And we have a great panel of experts here with us tonight. We're going to be talking about sports conditioning, re-entry into activities post-COVID, a very timely subject. And we'll also talk about ACL injuries. All righty, I think we're good to go here. Okay, so I'd like to go ahead and introduce our wonderful speakers tonight. First, we're very lucky to have Coach Dave Gray with us tonight. A little bit about Coach Gray, thriving on a passionate belief in the power of sports to revolutionize and redefine the course of a life, Coach Dave hopes to afford kids new perspectives and positively influence how they see themselves, others, and the world around them. Working with kids and young athletes is Coach Dave's passion and expertise. He's been running some of the most successful sports programs and events in the greater Pittsburgh area for 25 years. We also have Dr. Corinna Franklin. Dr. Franklin is a board-certified pediatric orthopedic surgeon and the director of sports medicine at Shriners Hospital for Children in Philadelphia. She is also the medical director of the Motion Analysis Center and is an associate professor of orthopedic surgery at Thomas Jefferson University and Temple University. Dr. Franklin is committed to the care of young athletes, and her main research areas of interest include sex-based differences in sports medicine and sports biomechanics. Dr. Sangemino is having some technical difficulties. We're hopeful that he's going to be able to hop on with us at some point. We also have Katie Civic-Lovgren. Katie has been a physical therapist for 17 years and has been with Positive Steps Therapy for the last 10 years. Katie is the center manager at the Wexford POI location and has gotten to work closely with some great pediatric orthopedic physicians, including Dr. Sangemino, who unfortunately is having some technical difficulties over the years, allowing her to assist in a variety of children through their rehabilitation. Katie enjoys being able to progress children from an injury back into their sport of choice, giving them guidance on reconditioning back into full play. Jenna Reeder is also with us tonight. Jenna is the director of Outpatient Centers for Positive Steps Therapy, as well as an outpatient and early intervention physical therapist. She has been with Positive Steps Therapy since 2010 and has helped lead the growth of PST, starting as the manager of the Butler Center and now as the director of all 7 Positive Steps locations. We also on the panel have with us Cheryl Hyback, the Senior Vice President of Clinical Services for the TheraPlay family of companies. She's also the founder of Positive Steps Therapy and is a physical therapist in her own right. So we are very excited to have this wonderful panel of experts with us tonight. And I will turn it over to you folks.
Okay, thanks so much for the introduction, Jason, and welcome everyone tonight. We're glad you're joining us on this topic that we're all really excited about to share with you, especially in the time that we're in right now. And so we want to talk a little bit about what conditioning is to start with. So conditioning really is the process of completing physical training. So it's something that we do to become physically fit, whether it's through a regimen of exercise and diet and rest. Some people do conditioning for improving their quality of life and overall health. And some do conditioning really to improve their sport performance, whether that's improvement of their overall health, a specific enhancement of their skills related to a sport, and even maybe secondary reduction of risk to injury if it's someone that's active and or an athlete and playing a sport. And why is conditioning important? So there are lots of benefits. There are many benefits to conditioning. First and foremost is really that activity and exercise is known to improve our health. It's known to reduce the risk of developing certain diseases and keep us healthy long term. It can have immediate or long term health benefits. There are also other benefits to conditioning. So it can increase someone's self confidence. That can include on and off the playing field for children that are athletes or in sport. Completing conditioning drills in a controlled environment. So, for example, maybe a little one that's practicing playing catch at home with a baseball, it really is shown to help improve their confidence of that skill when they're at their first practice for a little league game or getting ready to play a baseball game. It can help with the promotion of mental health, reducing feelings of anxiety and depression. That confidence that we just talked about really then transitions and translate to decreased feelings of anxiety in certain scenarios. So maybe a child who may be anxious about being on a soccer field with the fans around them might feel more confident after they've had the opportunity to practice and play in the yard with their friends doing the same game, the same drills and skills, just playing. Other benefits may include strength and resilience, increasing strength, power, and endurance. So the ability to, endure a long game if they've just been physically active, ensures quality of practice. It can promote quicker and fuller recovery. So if someone does sustain an injury, someone that has completed conditioning and been active may not need as long of a recovery period. It can decrease the number and severity of injuries. It optimizes cognitive skills. It prevents chronic disease, and it can also aid in weight management as well as improve quality of sleep. Okay. So things to consider and what maybe would be included in a conditioning program. A good physical conditioning program really should include activities that include all areas. It shouldn't be one-sided or another, so it should really be balanced, therefore not causing injury. Being physically fit for one sport or position doesn't necessarily mean that an athlete is adequately prepared for another sport, and overall balancing that condition is really important. So you'll see the list here of a multitude of areas that are important in a conditioning program to make sure that it's balanced. So agility, speed, endurance, power, strength, flexibility, balance, coordination, and dexterity. Although maybe not um, high level in one sport and different in a multitude of sports, are all important overall for general conditioning and health. And then conditioning should really be age specific. So there are 3 different phases here. The pre-adolescent athlete, we're really talking about kids who are under the age of 10. And at this point, they should really be focused on being a kid. They should be active all year round, whatever that looks like. It might not be structured or a sport-specific conditioning program. This is the time when they're really learning fundamental drills and skills, learning how to be active and healthy. It should be well-balanced activities to include strength, endurance, balance, coordination, speed, agility, and a time to really have an introduction to a variety of sports. And I know this is an age that Coach Dave Gray may want to jump in here and speak to a little bit more.
Yes. I like what you said about just being a kid. And so my passion is working with kids that are like 2, 3, 4, and 5 years old. And the reason I've been successful in running programs over the years is because I found a way to disguise working out and exercising by making it fun for the kids. So a couple of the things that I love to do, when you give a child a challenge, especially at that age, 2, 3, or 4, when you ask them to do something, it's like an intrinsic motivation that they want to challenge themselves to do it. But you have to have them mimic your movements. So what I love to do is, for instance, I'll say, okay, we're going to do animal stretches. And so I'll pick an animal, or I'll let the kids pick an animal, and then we'll stretch or move like that animal would move. So if I picked, just the other day, I said, okay, we're going to do a flamingo. Who can be a flamingo? The bird that stands on one leg. And so I challenged the kids to balance and stand on one leg. And the idea is you create an image in their mind of an animal or a movement, and they mimic that movement. So it's important to show and to demonstrate the movements so that the kids can watch and take it in, and then they try to perform the movements. But it's always been so much fun. Another thing that we like to do, kids love to run around and do little obstacle courses. So on a very, very simple level, as simple as putting tape on the floor in a line, or cutting pieces of tapes and make like an agility ladder so that they don't trip or fall on any equipment. Kids love to challenge themselves by doing like a balance beam, standing and walking on one line, or jumping over the line, or hula hoops, you know, jumping on a hoop in the space between a hula hoop and advancing forward. So, you know, I always tell coaches, you know, that work with kids that age, if you can, in their mind, create a scenario where they can picture themselves doing or being something and disguise that through fun, but they're actually moving and they're exercising and they're sweating and they're not thinking so much about doing any skill or movement perfectly. The idea is to make it fun for them. So as they get older and they're in PE and okay, jumping jacks, push-ups, they're not just going to automatically say, exercises or jumping jacks. Something in them's a light bulb's going to go off and say, yeah, that's great because I know how to do that. I can be a leader. So it all boils down to instilling self-confidence and self-esteem. And at the age, you know, 2, 3, 4, and 5, and of course, all the way through 10, that's where you can really reach them and lay the framework for them to enjoy the future athletic success. But besides athletics, just being in a, you know, a state of well-being. So. Can I mention one other fun game that I like to do with the kids, if anybody's listening? And you can do this with your kids at home, or if you have a neighborhood group of kids, we call it the pirate game. And you don't even need any equipment, but all the kids love to be pirates. So I would say, okay, we're all pirates. Everybody, what's your pirate name? And they'll yell out a name, they'll make up a pirate name, but then you take them through movements. They imagine they're a pirate on the ship. So they have to hoist the sail. So they're all standing up, they're hoisting the sail. It's time to swab the deck. So they get their mops out and they're swabbing the deck. But all of these things that pirates would do, it's giving them an opportunity to mimic those movements, and it's a great workout and it's fun. So if you can keep them captivated and having fun, then they're just not going to start something and quit, you know, a second or two later. So, you know, it's just all about creation for kids that age.
Yeah, I think along with that, Coach Dave Gray, a good activity is yoga for kids and making the yoga poses into a great scenario for them, right? So, you know, a similar thing. Let's get in a boat, let's row in our boat, and let's go to the jungle, and let's get to the jungle, and what animals do we see? Okay, let's be a flamingo, let's be a bear, you know, and making it fun. They don't realize that they're doing things that work on their balance and their strength while they're they're doing yoga and having fun.
And real quick, and so just as important, and more importantly, at that age, they're developing and strengthening their mind and their thinking skills. And so, you know, it works hand in hand. So yeah, the yoga, I love that. We do that. And they challenge themselves to be able to do the different yoga poses. So I encourage, if there's any parents or guardians listening, do these things with your son or daughter or the neighborhood kids. It's such a great opportunity for them to learn and for you to have fun.
Yeah, I really love, as you touched upon, Coach Dave, about the agility, about the obstacle courses. That's like one of our favorite things to do with kids in therapy, and letting them pick out some of the items for them to try to challenge themselves. And, you know, even at that age, then kids are trying to better themselves. Maybe next time I won't fall off the balance beam line, you know, I'll be able to take 5 steps instead of 2. So I think that helps them as well too, as they set little goals for themselves, not even realizing it.
Okay, great. And so then the next stage and age where may consider is the early adolescent athlete. So the athlete 10 to 13 years old. At this point in time, the athlete is focusing more on some technique. They're refining the quality of their sport and maybe sport specific skills. And then the middle adolescent athlete is the older teenager, 14 to 17 years old. At this point in time, they may be involved in high school sports. There are 4 different training seasons that might be included in that sport. So it's important that it's an all year thing to maintain their conditioning, maybe not specific to that sport. So it might include a postseason, off-season, preseason, regular season. And again, each component of that is a little bit different depending on the athlete, the sport, and the player.
And I would have to say that definitely after what we went through last year throughout the pandemic and being quarantined for so long, I think we saw a lot of probably deconditioning coming out of that when children were able to get back into any activity outside of their house. Personally seeing different types of injuries come through our clinic that were very prominent amongst one group of, whether it's the early adolescent athlete or the middle adolescent athlete, that it was just something common that we were seeing from being deconditioned and sitting at home, unfortunately. So we definitely experienced that. And I can see that, it definitely speaks to the importance of general conditioning throughout the year to help our athletes.
Okay. Anyone have any questions at this point in time? I think then we can move on to Dr. Franklin.
Okay, thanks so much. I'm just going to share some slides here. And if any of the panelists want to step in at any point and make some comments or ask questions, please feel free. So I'm going to talk about ACL mechanics and specifically ACL injuries in adolescent females. So there have been many recent famous ACL injuries in both male and female athletes. The ACL itself, as we know, provides knee stability. So its main action is to prevent the tibia from sliding forward against the femur, but it also provides a restraint to rotation. There's about 100,000 ACL injuries per year in the US, and it's often ruptured, particularly in female athletes, over non-contact pivot injury. So someone turning around the ball or planting to turn before getting to a ball. There's been an enormous increase in ACL injuries in skeletally immature athletes in the last decade. By some measures, maybe a 400% increase. And unfortunately, every ACL injury creates the increased lifetime risk of arthritis, particularly with a meniscus tear. So in general, there's between a 21 and 40% increased risk of arthritis 10 years after your injury with a meniscus tear. And you can imagine if you're 15 when you tear your ACL, right, that's like, you're not even 30 and you've already got this big risk of knee pain and arthritis. Repair is rarely feasible. Now there is a group in Boston that's doing really interesting work on repairing the ACL in young patients, but it's still kind of being studied, and it's only in select cases, and it's really not commercially available yet. For the most part, in young athletes, they really need to have their ACL reconstructed to be able to get back to sports, particularly at the same level. There's pretty good evidence that continuing to play in an unstable knee both is unsettling for the athlete, so they're unable to return to play, but also risk damaging the cartilage in your knee. Typically, we do this arthroscopically with a tendon graft. There's a lot of different options. In young patients, there's really good evidence that it's important to use the patient's own tendons. So autografts in someone my age or older, you could use allografts, but young people really need autograft. I've been moving towards mostly using the quad tendon as a soft tissue graft, so without bone attached for young people, and I'll talk a little bit about why I think that's important, particularly in female athletes, but certainly people can elect to have allograft instead, especially as they get older. So, I think sometimes people may wonder, why is this important? If you can fix it, like, what's the big deal? Well, unfortunately for young people in particular, rehab is a long, difficult process. For those therapists on the webinar, I'm not telling you anything you don't know. For me, it's 9 months before you can go back to sports, because there is fairly good evidence that for every month sooner that you go back, there's an increased risk of re-rupture. So ideally, we would just prevent these from happening at all. And I think this really ties into a lot of what we're talking about with conditioning. So female athletes, unfortunately, are 2 to 8 times more likely than their male counterparts playing the same sport to sustain ACL injuries. And there's also been an enormous increase in the number of women and girls playing sports since Title IX was passed, which was in the early 70s. So at the college level, there's been a 5-fold increase, and at the high school level, there's been a 10-fold increase, which is fantastic that all these young women are getting the opportunity to play, but also means that there is a lot of increased risk for ACL. So interestingly, the risk doesn't appear until after puberty. So for example, 10-year-olds have the same risk, but 15-year-olds do not. And there's a much higher risk per hours of exposure to girls than to boys. And even it's just as prevalent in college. So collegiate soccer or basketball players are 5%, or the rate for female athletes is 5% per year, with less than 2% in men. And these are elite, high-level athletes. So again, the risk is really throughout the range of types of athletes. We talked about that already. So there's a couple different proposed factors for why women and girls might be at greatest risk. There's some suggestion that because women have a smaller notch, even compared to their overall size, but that's not well correlated. Women also tend to have smaller ACLs, but we don't really know how this plays into it. And unfortunately, there's not much we can do about it. So it's probably not worth getting into it too much. The same is true for tibial slope. Women tend to have wider hips, and meaning that their Q angle is higher, so their knee is in more valgus, and that may place the ACL in a more injury-prone position. And then girls tend to get more lax after puberty, whereas boys tend to tighten up a little bit. And so that increased laxity may contribute to ACL injury as well. There's some interesting factors related to hormones, which is that in the first half of the menstrual cycle, female athletes are more predisposed to ACL injury. There seem to be more injuries at that time. And there are estrogen receptors on the ACL, and as well as relaxin receptors, which seem to correlate with ACL injury. And there actually have been some studies that demonstrate that athletes who are taking hormonal contraception, meaning they're suppressing that ebb and flow of your inherent estrogen production, that's protective. I don't think the evidence is good enough that we would, let's say, put a whole soccer team on birth control pills who otherwise wouldn't be taking them for that purpose, but there is some evidence that they are protective. So now the main thing that I want to talk about, and really tying into what Katie, Jenna, and Coach Gray were discussing, are modifiable risk factors, which are biomechanics and neuromuscular forces and control. So the hamstrings are really important in terms of protecting the ACL and the knee, because they're in the back of the knee, right? They can help protect that forward motion of the tibia against the femur. But women in general tend to be more quad dominant. So women tend to overuse the quad and underuse the hamstrings, which leads to lower strength and activation in the hamstrings, lower torque in the hamstrings, and that can't protect the knee as well from the force on the knee. There is some evidence too that women and girls tend to jump and land in a more at-risk position. So with the knee in valgus, the hip adducted, and the hip and knee less flexed. You can see kind of an example here on the right. This is just an overview of the safe position and the unsafe position. So what's nice about these biomechanical issues is that they're very modifiable. So you can do a number of things, including strengthening the hamstrings. You can teach girls and women how to jump in a safer way. And there's a lot of different types of programs you can use. So you can, hopefully this video will play. Okay, we'll just skip through that. So there are a number of training programs that have been designed for female athletes. They're neuromuscular retraining with plyometrics, and they've really shown to reduce ACL risk by correcting these risk factors. One of the first of these was designed by Bruce Mandelbaum and his group in California, and he had over 1,000 female soccer players. And his program includes a warm-up, stretching, strengthening, plyos, and agilities, all of which you mentioned, Jenna, right? These are all important activities for athletes to be doing. This program was designed to be done at the beginning of soccer practice, so as an integral part of what the athletes are doing anyway, and actually found this enormous reduction in ACL injuries, 88% fewer in the first year and 74% in the second year. So these programs there's a number of different ones. This is another example here. And again, they provide a nice addendum for younger athletes. This is one from CHOP. There are a ton of different ones you can use. And I think the fact that these can be so effective in reducing ACL injuries also emphasizes the importance of conditioning, right? These are basically conditioning, different types of conditioning that soccer players, basketball players, any type of cut pivot athlete can really incorporate into their regimen. And there's a recent study that showed that it's not necessary, for example, that a PT be there the whole time, or if a trained therapist or an ATC can teach athletes and coaches how to do these exercises. And as long as someone like a coach is well versed in how to do them and can cue the athletes, that's enough for these to be protective. And I think that, the point, I'm going to stop sharing my screen. I think the point that I'd really like to take away is that though female athletes have this enormously increased risk, it's also enormously modifiable. So with a little bit of adjustment, we can really prevent these devastating injuries from happening in young women.
Dr. Franklin, I'm curious in your practice, because one thing I see as therapists, we get the female athletes right after the injury has occurred. What are you seeing, whether it's in the Philly market, in regards to those proactive programs? I mean, you kind of mentioning those. Are you seeing those be enacted well in the schools? It's not something that I feel is happening to where I'd like it to be.
So I would say, unfortunately, it's pretty variable. Because we do try to do education days like these and get the word out that it's important. We have had some teams invite our team to come out and instruct the coach or the players in how to do it. I do think that that people are developing an increased awareness of how important it is to every athlete to have an overall physical fitness, not just be good at their particular sport. So sometimes that does translate into better biomechanics and things like that. But I think, unfortunately, there's still a lot of places that are not doing it. And then I think I want to come back to what Jenna and Coach Gray were saying earlier, which is that there's no age that is too young to start being active and to start thinking about conditioning, right? Obviously, small children should not be lifting heavy weights, but that doesn't mean they can't do yoga, they can't do body weight strengthening exercises, they can't learn how to move their body in a safe way. I think if we wait till kids are in high school, we've really missed the boat in terms of getting on top of dangerous and maladaptive activity patterns.
I mean, the one thing that I can comment on for the Philly area is living down here and working for TheraPlay. Our coaches have been much more educated. They're seeking out the information. They want to know, especially after COVID with the deconditioning that's happened with some of these kids, they're seeking out our advice, our guidance on whether their own kids have come to TheraPlay or whether they're just seeking out how to keep their players healthy. We are definitely seeing more where they want the warm-up ideas. They want to figure out how they can keep their athletes safe.
I think that's great. I think the other thing I'm seeing though in the having kids right in the sports scenario right now, the one thing that concerns me is as we talk about training, we look at it being global. And Jenna, I think you hit the point of it being multiple sport or a variety of things, not just being focused. And I am seeing, to my not very happiness, I guess, is the fact that we're doing one sport and we're doing it all the time. And there is a lot of pressure I'm seeing in that kind of sport specific training or one sport at a very young age, just based on, we're going to play basketball year round or we're going to play baseball year round. And I definitely see a detriment to our kids when we're kind of going in that direction.
Oh yeah, I think there's excellent evidence that is really risky. It's dangerous to play the same sport year round. And I also think there's excellent evidence that the best athletes don't do that. I mean, Patrick Mahomes, for example, played baseball in addition to football. And so even the highest level athletes diversify. And whenever parents have questions about things like this or bring in, even seniors heading off to college, I try to recommend, take one season and do something a little bit different. You can look at, if you do a season of track, for example, that may make you better at soccer because you spent a lot of time focusing on your running. It's totally fine to take one season. I mean, and I think I would say the real risk is when kids are not only playing year round, but also playing on multiple teams. So school and club and travel. And that's especially dangerous for throwing athletes. Because then it's really incumbent only on the athlete themselves to keep track of their pitch counts, which across multiple teams is very difficult, and that can really put young shoulders at and elbows at a lot of risk from overuse.
Yeah, and I would completely agree with that. My middle son plays baseball, and honestly, like our pitchers, because they're used across multiple teams, if they're not speaking up, they will be encouraged to pitch across most of them. And it's really a hard balance to find what is that good medium and who's going to speak up. And a lot of the times it is the parents who are also pushing because they want their kids to be the best. They want them to get a lot of playing time, and that's not necessarily the best. So I think parent education is huge in this, because if they're not backing up their kids and supporting them and supporting the pitch counts and supporting everything that could potentially prevent the injuries, then we're really kind of behind the 8 ball to begin with.
Yeah, I think that's really true. And Coach Gray, I don't know if you also have had this experience with parents where they're really pushing you to do things that are unhealthy, perhaps for the child, perhaps out of a lack of knowledge or lack of understanding of how dangerous overuse can be.
Yeah, I see it a lot. I'm fortunate that I have a reputation that parents know that when they come to one of my leagues programs, it's not about the score, it's about the process. So they know that going in, and I make it very clear with any of my programs. But one thing I've been working on, especially with my older, 10, 11, 12, 13-year-old athletes, is we were talking about parents communicating and pushing them, or parents talking to the coaches. I'm encouraging the athletes themselves to really take ownership and communicate directly with the coaches. If you're not feeling well about something, they know their body better than anyone. And so when you go back to pitch count and things like that, a lot of times they're just going to go with it because they're afraid to rock the boat. And so I really encourage, and I want parents to encourage, that their son or daughter communicate with the coaches. If it's a playing time issue, before the parent talks to the coach, I want the player to approach the coach at the appropriate time and just have a dialogue, a polite dialogue as to, what they can do, what path they can take to be successful, whatever that means to them. But want the player more ownership of the whole youth sports situation.
I think that's incredibly important. I mean, I think for a long time there's been a culture of athletes to just be silent and suck it up, and grit means playing through whatever you're asked to play through. And I think we can see in a lot of circumstances, especially for young women, that has resulted in a lot of really terrible outcomes. And so I really commend you for focusing so wholeheartedly on empowering athletes to respect their body and to speak up. I think the more we can train athletes to do that, the better it's going to be for them globally, not just in terms of their performance, but their mental health, their physical well-being, and their safety.
Absolutely.
I think sometimes as a therapist after an injury, we'll see that kids will say that they're feeling fine and their families also agree, hey, they're feeling good, they're ready to get back to sport, but we're able to sometimes help objectify that information to say, yeah, but look, you're still not able to do this, or this is, maybe what your ability, your strength, and your hop score is, or, just some examples. And this is what you really want to be at so that you're safe to return to sport. And I think sometimes after injury, PT is really helpful to help the family and the athlete or the child understand that information as well.
Well, I think, in the course of rehabbing a long injury, often the therapist is the person who spends the most time with the athlete, right? Like I'll see them for surgery and then for periodic clinic visits. But if they're in rehab for 9 months, right, there's a therapist who sees them a couple hours a week, every week for 9 months. So that's really who's keyed into what's going on with the athlete. And I think as an orthopedic surgeon, it's really essential to have good relationships with therapists, because that's really who's going to tell me when something's going south, or if we need to be worried about something, or even just to let me know that things are going okay. I mean, I would say I really rely on my therapy team to keep me informed about how my patients are doing.
I would say that to me is one of the most, the biggest, the greatest key to success is being able to have that two-way dialogue from the therapist and the physician. And it is one thing that we're fortunate at the POI, we're able to do regularly. It sounds like with your team as well. But even because you have that conversation and everybody's on the same page, the parent is also then becomes a little bit more engaged, or they value the fact that the team is all in the same place. And that's really important to be able to speak to that and have that opportunity. I am curious, and I could talk about this all day long, so please, anybody can jump in, but I am curious in regards to knowing that we're in the scenario with the pandemic and we're seeing a lot of deconditioning. I'm curious to know if you are seeing an increase in ACL injuries with those female athletes going back, or if that's just too early to know at this point.
I think it's a little early. I would say the last week or two, I feel like I'm starting to see more injuries in general. As things are starting to pick up, and also as the weather is getting nicer. So I guess both yes and no. We are seeing more injuries, but I think it's probably going to get worse. And I think part of the problem is that many of our athletes have really done their best. They've tried to work out at home, but it's just not, especially when you're young. 12, if you may be 12, 13, 14, you just don't have the same kind of level of coordination that, let's say, a college athlete would have, and you may also not have the same access to resources, a gym, space to train. So I don't want to blame athletes for the deconditioning, right? I think many people have been trying really hard, but it's not the same as having a coach, having a trainer, having a strength and conditioning coach with you, having your teammates with you to run drills with. So I think even the most dedicated athletes, I'm a little concerned about, like, over these next few months.
Okay, were there any other questions from anyone?
I think I'll chime back in with some questions here. Here's a good one. How can you determine if my child is ready to return to sport after an injury?
I can talk about that a little bit. So at Shriners, we have a pretty rigorous return to play protocol for ligamentous reconstruction. So for ACL or for MPFL, which is for patellar instability, we have a couple of different things we do. We do strength testing on a Biodex or similar. We do hop tests in PT, and then we do a complex gait sports assessment in our gait lab, which consists of 6 different tasks, including a drop vertical jump, a single leg heel touch, which is really like a single leg squat, deceleration, shuffle, a couple of things like that, and running. And then we have specific metrics that we look at that kind of encompass all those risks I was talking about, and then also a few more. So things that we know are maladaptive or dangerous gait patterns. For ACLs, we do all the tests, including the hops, the strength testing, and the gait lab test at 6 months to gauge how rehab is going. So to try to identify before it's too late if we're having a problem. And then again at 9 months, which would be our anticipated return to play. And obviously that can be modified based on things that may get in the way. So I would say during COVID, it's been a little bit slower. People have had a harder time getting to rehab. There may be, some other issues. And we've really found that to be helpful. Jenna, as you were saying, it gives us objective criteria to say, okay, you're clearly not ready for the following reasons. On the other hand, I think if people are cleared to return to sport, the athlete, the parent, and the coach can feel like we've really put them through a rigorous assessment, and they're safe to go back. And one thing I will say about that is that we use kind of objective numbers, not just a side-to-side difference, because sometimes we find that actually the non-operative leg is a little bit under-rehabbed on occasion. And if someone's had a non-contact injury, they may have started out with a problematic pattern. And so we actually want to send them back better and safer than they started. And the 6 months check is a really good time to see, oh, hey, actually, like the non-operative side has a little bit of a problematic pattern. So we're actually going to like dive into that side a little more carefully as well, so that we don't risk sending you back and tearing your ACL on the other side, right? Which is, as we know, is a real possibility.
I just want to chime in again really quick with something that I forgot to mention at the beginning. For anyone who is in attendance who is seeking Act 48 credits, everyone who's in attendance tonight is going to get a follow-up survey in the email, at the email address that you use to register. And there will be instructions on how to get those Act 48 credits within the survey. I just wanted to point that out to anybody who's still with us tonight. Another good question: what types of things do you work on in therapy to condition a child for getting back to their sport?
Sure. So it depends on the injury, I guess. But so, for example, a lower extremity injury, we would ensure that they have their full flexibility and range of motion. We would introduce strengthening at the time when they're pain-free and ready to do that. So that may be, different for every different muscle group or injury in the leg or lower extremity. We ensure that they have great balance and proprioception. So we had mentioned again, like the single leg hop test. So we'll do a variety of different exercises to work on their balance, whether it's on level ground, uneven surfaces, using Bosu ball dyna discs, balance beams. And then, progressing on to agility, speed, again, depending on the injury and the sport, and then sport-specific activities. Katie, do you have anything else to add?
And then I was just going to add in there, a lot of the times too, we are breaking down some of the sports that they're doing into different motions based off what their injury is. So we might break down a component of their sport and really look at the quality of motion and where they are there. And then slowly introduce them back into their sport. Maybe we give them clearance to do X, Y, and Z. They come back, they check in with us. We check, move on to the next progression again, based on their sport and the skills that they have to do during it.
Here's an interesting question. What is the difference between an adult physical therapy facility and a pediatric one? Is there?
So I would say one of the biggest differences with a pediatric facility is that a lot of times the therapists have a experience with pediatrics, so they are able to make the environment fun, different than an outpatient clinic, especially for the younger population and younger athletes under the age of 13, where we can incorporate games and obstacle courses and sport-specific activities, working one-on-one with the kiddos. In an adult facility, sometimes there are barriers to that, whether it's space, equipment, the volume of patients that are coming in are usually higher volume, seeing multiple patients at the same time versus one-on-one.
Yeah, and the only other thing I would add to what Jenna had to say is I think also we are very in tune with the stages that they're going through and the development and where their skeletal maturation is and what's happening. So I think that that's also a big component. And I think also we have a lot more experience working with pediatrics, also managing the families and educating them and incorporating them into the dynamic as well. Whereas if we were in an adult outpatient rehab, we're really just working with the patient. We spend more time educating the families as well as the kids.
Here's another one. If my child is injured, is it okay to continue or participate in conditioning?
That really depends on the injury. So that's probably a conversation that's best had with your child's physician. I would say there's almost always something you can do if your injury is isolated to one body part, right? So, if your knee is injured, you can certainly work on upper body conditioning as long as you're in a seated position without putting stress on the knee, for example. But it's really something that is best reviewed with your physician. And I would say one nice thing for me when I'm in sports clinic, I have 2 physical therapists with me, and that's something that they may be able to do is review carefully with a child and a family what they can be working on in order to stay fit while their injury is healing. Swimming is often a good activity because it's not high impact, but again, that just it entirely depends on what's injured. Obviously, if you've got a shoulder injury, swimming is not that's not the right thing to do.
Any suggested groups to participate in that are not sport specific?
I'll go back to the prior plug for yoga. I think there is no athlete for whom yoga is not helpful. When I lived in Boston, Baron Baptiste used to work with the Patriots, for example. So really yoga can help everybody. And if you have an intense athlete, restorative yoga might be helpful, but also power yoga can be really helpful to a variety of athletes.
I also know in the Pittsburgh area, there's some universities that will do like kid weeks or, kid training programs. I know Slippery Rock University has done one in the past. I don't know, with the pandemic, how schools are doing with those things right now, but that has always been a great option for kids to socially be engaged with other kids and be able to participate in activities that's not specific to a specific sport, but just being active.
Yeah, and I, not to put in a plug for Coach Dave, I would say his programs do have a variety of activities that engage children that are not totally driven towards one particular activity. So I can see that kids walk away from there trying a variety of things. And I think ideally programs like that are where we want to engage kids to have the opportunities to be fit and active in a positive way. So there are definitely programs out there to engage with.
It's funny, some of the exercises and fitness games that I do for the young ones, every now and again for the older kids, the middle schoolers or junior high kids, I'll throw it in. And it just takes them back to when they were young, and they're just having so much fun because they don't get the chance to do those things anymore. Everything is so regimented. I don't mean it like a blanket statement, but when do they get the opportunity to run, move around like a monkey, or sprint, red light, green light, just crazy things that you saw this past weekend. We were throwing the chicken in a bucket, and we had older kids that were just having the time of their lives. So, I think, if we can just bring back, working out and just being active, as it can be fun, but it starts at an early age and it becomes part of your living and part of your lifestyle, that you can always go back, and no matter what sport your expertise is in, there's always time to let your guard down and just participate in fitness for the sake of participating in fitness games.
Yeah.
So
it's funny you say that. We had that question earlier about the adult PT versus the pediatric PT. And I actually encourage our adult PTs to do some of the things we do in the peds clinics, because I'm like, it's amazing what you see, what your patients can or can't do. But I agree.
All righty, we'll end on one more question here. Is there an age that it would be safe for a child to specialize in one sport?
So, I mean, I think in reality that you should always be playing more than one sport. And if you're not playing more than one sport, you should still be conditioning the opposing muscles, because that's what's going to prevent your injury. So even if you want to be focused on baseball or hockey or football, there's still other activities during the off season that you should be doing. No child should be playing 12 months out of the year, 5-6 days a week, one sport, or even adults for that matter. Like a lot of the professional players, they still use alternative training techniques in order to keep themselves healthy.
Yeah, I really agree with that. I think, if you're going to be a varsity athlete in college, you may well decide, okay, I'm just going to focus on this one sport, but then you need to spend one season at least doing something else, working on different muscles, giving your body a break from the intensity of what you're doing. I guess maybe the answer is, like, if you're a professional, then it's okay to to focus on just one sport.
But I think, Dr. Franklin, to go back to what you said earlier, if you identify a lot of those elite athletes, a good bit of them were multi-sport athletes through, high school, college. And I get that that's not where we are completely now, but I do think still you see those children or those athletes have had success in multiple avenues.
Absolutely. And I think, it can be a good lesson too. And I wonder what Coach Gray thinks about this, but to maybe not always be the absolute star on the team, right? And in order to really be a good team player, even if you are the best on your basketball team, maybe it's okay to spend a season being like a mid-level player on a soccer team and learning to have to really engage with the team and sacrifice for the team.
That's such a good point. I see it a lot where you have a baseball player playing all year round, but I would say to them, hey, there's a flag football league. Do you ever think about just playing some flag football? Or there's this recreational basketball league. You might find out that you actually like it. And regardless, you're going to be building skills that you're going to use that you never thought of. So I think that's such a great viewpoint, Doctor. You won't be the best, but that's okay. Be the best person, be the best teammate, hone your skills, live up to any potential that you think you have. So I love that.
And it might actually liberate them to have a little more fun, if they feel like they're not pushed to be the best absolutely every season, and just relax and enjoy something a little bit, which can be a nice mental break.
Yeah, I think I want to use that. I really appreciate kind of that look at that as far as not necessarily being the best on that team and really engaging differently. I think that's a great point.
But I also think just what Dr. Franklin just said about that mental break too, I think that's super important nowadays as well too. Looking at the mental health as a part of conditioning overall as well.
Well, I think that's a really nice place to end it. Again, I want to thank our really great panel of experts to join us tonight. Thank you for taking the time. Also, a recording of tonight's webinar is going to appear on our YouTube channel, so please keep an eye out for that. And again, for anyone still in attendance, if you're looking for the ZAC 48 credits, make sure you take that survey that is coming to you in that email. So again, want to thank our experts and our panel, and thank you everybody in the audience for joining us tonight. Thank you so much.